Thanks, Alicia. Good morning, good evening, good afternoon, everyone. My name is Mohini Venkatesh, and I'm an advisor on school health and nutrition at Save the Children US. Welcome to the Fresh School Health and Nutrition webinar series. This is an opportunity for the Fresh Network to provide monthly presentations by leading policymakers, researchers, and implementers engaged in improving the health and nutrition of children in low and middle income countries across the globe. Today's presentation will be on the School Health Integrated Programming Initiative, which is a global program that supports governments to mainstream school health and nutrition interventions into national education sector programs by focusing on two key interventions on deworming and vision screening. We'll hear more about this program by our guest speakers today, who are Dr. Imran Khan, who is the Chief Global Technical Lead at Sightsavers and Director of the SHIP Initiative, as it's called. He's an adjunct professor of public health at Salus University and is also on several committees and working groups in relation to optometry and vision. He has a doctorate in optometry, an MSc in low vision rehab, and an MPH from the London School of Hygiene and Tropical Medicine. Joining him is Dr. Laura Appleby, who is associated with the Partnership for Child Development and is a researcher on school deworming programs and works to bridge the divide between academic research and programmatic implementation. She's involved in various research projects looking closely at the links between helminth infections and wash measures. She holds a PhD from the University of Edinburgh and a master's in the control of infectious diseases from the London School of Hygiene and Tropical Medicine. Over to our presenters now. Laura.
Oh, hi, everybody. Thanks, Mohini, for that introduction. So to prevent, you've given a great introduction on kind of the School Health Integrated Programming Initiative. And today I'll be presenting to you for part of the talk, and also I'll be handing over to Imran for the middle part of the talk as well, kind of in a true reflection of the collaboration and partnership that was going on for this program between Sightsavers and PCD for implementing an integrated program based in schools, but very much focusing on supporting the education sector, the ministries of education, to plan and deliver an integrated and efficient school health program. To start off with, just to kind of bring you all in, I'm sure you're all very well aware of the benefits of school health and nutrition, and I like to think that this infographic really represents it on many levels. And many programs and projects are often in developing countries able to implement and focus on one of these. But how do we realize this picture as a whole entity? How do we ensure that the schools are able to deliver this in an effective, efficient manner, while at the same time still being able to serve their primary purpose, which is for education? This picture really kind of symbolizes fresh. You can see the four pillars supporting the main school platform, and very key to this picture as well, and also to our program, is that messaging and the referral system. So the school is not an island isolated on its own, but it very much branches out towards the community, towards the health services, and that was what we were part of what we were harnessing as part of this program. So I'll hand over to Imran now for the next few slides, for him to introduce the program in more depth.
Thank you, Laura. Yeah, I think that's an excellent point about how we were using the School Health Integrated Program to really show how schools can be used as a platform to deliver health. And we'll go through the way that we developed the program, as well as a little bit about implementation and lessons learned. In terms of the way that the program was really conceptualized and managed, that it was funded through the Global Partnership for Education, or GPE, grant, and it was a GRA, or a Global and Regional Activities grant, in the second tranche of funding. And the program was carried out for 11 months during 2016, managed through the World Bank in partnership with Sightsavers and PCD. Really, the goal of the overall GRA fund and how this project contributed to that was really to generate knowledge sharing and development, both at regional and country levels. And in terms of the countries that the program was piloted in, these countries were Cambodia, Ethiopia, Senegal, and Ghana. And we'll go through the descriptions of the learnings within each of those countries, but it's important to understand why these countries were chosen to roll out this SHIP initiative. And part of the reason was that these were all GPE-supported countries, and also countries that the World Bank also was interested in engaging in further. But really, we wanted a good regional mix of countries, also looking at different, we had a Francophone country in Senegal, Anglophone with Ghana, a South Asian country in Cambodia, and the East African country with Ethiopia. So we felt we had a good mix that we could learn from, not only carrying out the intervention in these countries, but really using these countries as a model to replicate and scale up in countries within the region. Next slide. So if we talk about the issues that we wanted to address within this integrated program, we were looking at two novel interventions, and that's within refractive error and deworming. And at first, it sounds like a kind of a random mix of deworming and refractive error. And really, why did we choose these two interventions? And you could ask, what do these two interventions have in common? Well, the reason we felt that these two interventions were important to include within this package is because both of these conditions are easily identifiable, easily treatable, but they both impact a child's ability to reach their full potential in schools. So if we talk about refractive error, we know that about 10% of students in primary schools in developed countries have poor vision, and 80% of learning is visual. So when we think about that, it's really a child who's unable to see the blackboard or is unable to see to read. They're not reaching their full potential, and they have barriers to learning due to not having access to be identified with